Alright, this video is going to demonstrate sensory level pain control as well as motor level pain control via biphasic settings on the Dynatron machine. So we'll start off and we continue to verify absence of contraindications. We inquire about previous treatments. We ask the patient to remove any jewelry or bandages from this treated area. We prepare electrodes with the appropriate leads. For this demonstration, we're going to use a bipolar setup. Our patient has already cleaned the area to be treated or used alcohol swabs prior to placement of the electrodes. And the area that has pain is the wrist extensors, so we're going to surround that area with our electrodes. So when we turn this machine on, we're going to be looking for the biphasic settings. So right over here we want to push that button until the green light shows up. We want it on a normal setting, and then we want the current to run continuously, so I'll push that down to there. We want a minimal ramp on it. Doesn't matter really, the ramp will be just half a second when we start this, but it's going to run continuously, so just leave that alone. As far as time, 10 to 20 minutes depending on our goals, so we can adjust the time here. When we push the button again, it goes next to rate. For sensory level pain control, we want 80 to 200 pulses per second, so we can increase that. And for width, we want 60 to 100 microseconds, somewhere in there. Alright, so we go ahead and push the intensity on and start. We're looking for sensory level pain control, so we're only going to increase the intensity until our patient says that they feel a current, and she indicated that she felt a current. Then we're going to go ahead and increase until we find a muscle or a motor response, or the patient tells me that it's becoming uncomfortable. And the patient indicates it's becoming a little bit uncomfortable, so we'll leave it at that setting, bring it down a little bit, and go ahead and let it run for the amount of time that we've indicated. When the treatment's done, the machine will automatically shut off. We'll ask the patient how they're feeling, document that, take the electrodes off, inspect the area, and then clean the treatment area as well. Now, if we're going to use this for motor level pain control, we can just leave the electrodes in the same place. But just a reminder that when we set this up, again, we'll have biphasic on normal with continuous, but our parameters are going to be a little bit different. So our pulse rate right here will be 1 to 5 pulses per second, so we got to bring that way down. And then our pulse width or duration needs to be between 150 and 250 microseconds. So that's set up, it'll be fine. And we will start to increase the intensity until we get a muscle twitch at the treatment site, and then at that point we'll stop. So that's the only difference, is setting up the parameters.